Good morning. My name is Stephen Parrish and I'm the Marketing Director for the Crescent Medical Bridge GAP program. I want to talk with you a little bit this morning about GAP, make sure you understand how employers can use this coverage to lower their premium, and make sure that the employees don't get hurt by raising their out-of-pocket costs when switching to a higher deductible plan. First thing I want to tell you is that GAP insurance has been around for a little while, but it has gotten a lot more popular recently just because of the trends in healthcare. As you guys know, healthcare has been going up a little bit, and GAP is a way that we can help control those costs by switching to higher deductible plans and insuring those deductibles with a GAP plan. The following slides are going to show us where the market's been going in the healthcare industry. You can see here that back in 1999, the cost of health insurance for a family was about $5,800. Since then, it's risen all the way to $15,000. That's a 175% increase in just over 10 years. Bad news is it's not really expected to slow down. By the year 2020, experts expect that the premiums will be up near the $30,000 range, which is something that, I don't know about you, but not really anybody can afford that. So what are people doing? Employers are switching to higher deductible plans to offset these costs. By going to a higher deductible plan, they lower their premium and are able to maintain health insurance for their employees. At the same time, you want to make sure that you can make that affordable though, and that's what GAP is for. But you can see here that just in the past 5 years, there's been a really large shift in higher deductibles. 2006, only 6% of small businesses had a deductible of $2,000 or more. 2011, 28%. That's a pretty big jump. So people are already doing it, and the industry is headed that way. GAP is where that's going to be. It's going to leave the door wide open for GAP insurance. It's exactly what we want. Okay, so GAP is really two things. It's inpatient and it's outpatient. Inpatient is going to cover all of your overnight hospital stays, your hospital visits that require surgery, anything like that where you're in the hospital overnight, we're going to take care of it. Generally, we just set that amount, whatever your deductible is. So if you're switching to a high deductible, like a $5,000 deductible, we'll put your inpatient at $5,000. That way, if your employees have to go into the hospital and stay overnight, we're going to pay pretty much the entire deductible there, $5,000. Then we'll take your outpatient benefit and set it 40 to 70% of the inpatient. So in this example, if we did 70% of $5,000 is $3,500. So this plan would be a $5,000 inpatient with a $3,500 outpatient. A neat feature about our plan is that it pays first dollar. So if you have to go into the emergency room and maybe you've broken your arm, and you're going to end up having to get that fixed, and your bill's $1,500 or $2,000. If you've got a $3,500 GAP benefit, we're going to pay every bit of it, and that's a great feature for the employees. So again, the key components behind GAP are inpatient and outpatient. Just remember that, inpatient and outpatient. And those expenses, by the way, cover things like, at least on the outpatient side, MRI, radiological diagnostic testing, outpatient surgery, x-rays, emergency room visits, outpatient chemo and radiation, things like that. All those can be done on an outpatient basis at the hospital or at an approved outpatient facility. We also have doctor's office visits and ambulance visits that are available if needed. Alright, now let me show you how the GAP works. Okay, now there's really two parts of it. There's a saving money piece, which is really important to the employer. But then almost more importantly, there's a coverage piece. I want to make sure that the employer understands that we're not going to be just forgetting about the employees here. We're going to be giving them really good coverage. It's going to make them feel comfortable. Okay, but here, let's look at the savings involved. We took a group that had a $1,000 deductible, 80% coinsurance, and they were paying about $17,500 a month for that coverage. So in an effort to save some money, we went to a $5,000 plan with 80% coinsurance. And that plan was only $9,400 a month. Big savings there, over $8,000 a month savings. But the employer was worried that the employees would feel like they were getting shafted a little bit by having this high deductible plan. So we just insured that high deductible with a GAP. You can see down here we did inpatient at $5,000, outpatient at $3,500, just like I told you. The GAP premium is $3,000. So when you add this $3,000 to this $9,400, you come up with $12,429. Which is still $5,000 less than what they were with. So you can see we've really put them back almost exactly where they were, but it's $5,000 less. You're going to save 30% and get basically the same thing. Now let me show you what I mean by that. Okay, this is the exact same plan here with the $1,000 deductible and the going to the $5,000, and let's look at two different claims. The first is an inpatient claim, $12,000. Okay, so you've got your deductible and some co-insurance here with the current plan. Employee's going to owe $2,500. No gap plan here. Employee's got to pay $2,500. Over here, again, we've got this big $5,000 deductible, so they got to pay that and then some co-insurance. They're going to owe $6,400. Gap plan pays $5,000. The employee owes $1,400. So right there, you can see that, hey, same claim, they're actually going to be paying less here with this new plan. Let's look at an outpatient, probably a lot more common claim here. Let's use your child is playing soccer and he falls and breaks his arm, has to go to the emergency room. Trip to the emergency room and the x-ray and the treatment, the cast, it all comes to $3,500. Okay, so with the current plan, they got to satisfy their $1,000 deductible and there's some co-insurance, so they owe $1,500. No gap plan again. Employee comes out of pocket $1,500 for that broken arm. With our gap plan, now this is what's really cool. Okay, so they got a $5,000 deductible, so looks like they're on their own for the whole thing, right? $3,500. Well, again, remember we put in a $3,500 outpatient benefit. So the gap plan is going to pay $3,500. The employee pays nothing. So one plan they owe $1,500. New plan with gap they owe $0. Let me go back. Save $5,000, but you want to make sure you're getting good coverage. $1,500 here, $0 here. The coverage is sound. It's a very good plan. Gap is designed to make sure that the employees are not going to be hurt by going to these high out-of-pocket costs. And there's enough savings involved that you can pay for the gap plan too. So again, we're looking here. They've saved $8,000 a month by going to this high plan, and the gap only costs $3,000. So there's a margin there of $5,000 a month savings. It's a phenomenal way to get your premium down. Pros and cons are we've got no deductible with our gap plan. It pays first dollar. So there's no need to worry about having to satisfy deductibles or whether or not you should make the claim. We're going to pay first dollar. And employers, I don't want you to worry about utilization going up. Utilization trends show that just because employees will have access to this first dollar coverage doesn't mean they're all going to run out and go use their health plan. It still shows that people tend not to like to go to the doctor. And so just because they have that first dollar coverage there doesn't mean that they're going to utilize their plan more and then in turn raise your premiums. We've seen that it doesn't actually do that at all. That actually utilization remains fairly constant. It's just an added benefit to your employees. Our outpatient benefit can go all the way up to $7,000. A lot of our competitors cap theirs at $2,500. But if you've got a really high deductible plan, maybe a $10,000, it's nice to be able to get way up there. Probably the biggest thing that sets us apart is that our rates are extremely competitive. You've got to have low rates in order to make the gap work. You've got to make sure that you can create enough margin by going to a high deductible plan and then have rates that are affordable enough to fit in there and still create a savings. We pay benefits for deductibles, co-insurance, and co-payments covered by the health benefit plan. That's pretty common, but we want to make sure that we understand that a lot of plans only just cover the deductible. Other features that our family limit is 3 times the insured benefit. So if you've got that $5,000 inpatient benefit, your family is going to have up to $15,000 coverage. Last feature of this is that it's guaranteed issue with no pre-existing conditions. That's a huge feature for employees and a great selling point for the employers. Quoting procedure is very simple. Just need a census with the name, birth date, and coverage level, and then I need the current and the renewal plans with the rates, and then throw in a couple alternate plans with some higher deductibles and rates. When I've got all that, we can really analyze all the plans and find the best one for you. It's always good to be able to show the savings and show those claims examples when you're sitting down so that it's understandable and easy to understand for the employers and the agent. It's also important to know what state the business is headquartered in. Again, I'm Stephen Parrish, Marketing Director for the Crescent Medical Bridge program. We typically work through brokers and agents, so please find a broker or agent in your area that currently offers the Crescent Medical Bridge plan. We're looking forward to earning your business and hope you have a great day. If you have any questions, please feel free to reach out to me. Thank you.